So let's address the big elephant in the room, the breast cancer risk. This is the number one thing women, say that the myth that's out there is that hormone therapy increases your risk of breast cancer. So if you learn one thing from this whole webinar, this is what I want you to learn. Menopausal hormone therapy does not increase your risk of breast cancer over your baseline risk, period. It does not cause breast cancer, does not increase your risk. In fact, this big study I talked about, the Women's Health Initiative, on the 20-year follow-up, and this is a quite remarkable statement, so let this sink in. 30% decrease, not increase, decreased risk in women taking estrogen. That's powerful. There's no other medication on the market that has ever been shown to decrease a woman's risk of breast cancer this much, okay? The preponderance of evidence tells us that menopausal hormone therapy does not further increase the risk, even in our most high-risk women. Those are BRCA1 and 2 mutation carriers, which I am one of, and so is Monica. So we can safely give menopausal hormone therapy to these mutation carriers. We often call them previvors. They've not had cancer yet, and it's not increasing their risk, okay? And very, very important to note, all hormonal therapy is not the same. So modern menopausal hormone therapy, really the kind of the standards that we use today is a bioidentical estradiol, so not a synthetic equine estrogen that was used back in like the Women's Health Initiative study. And these are FDA bioidentical hormones that are commercially available, and real progesterone, not the synthetic form. And so the data has shown that it's the synthetic form, particularly the synthetic progestin, that was associated with some theoretical increased risks. I think this is a quick slide I just want you guys to take a look at. This is CDC data on the incidence of breast cancer between 1999 and 2019. The dark arrow there represents the time when the Women's Health Initiative study was released, and all the news outlets and the media, they all scared women, and literally overnight, people went off their hormones. So if you'll see, this orange line is this almost 80% decrease use in hormone therapy, getting to the point where that trend continued, that basically 75% of women today do not treat their menopausal symptoms. They feel like they've got to kind of like suck it up because they're afraid of breast cancer. But look what happened, this dramatic drop in hormone therapy use. And look at the blue lines, the blue bars. Breast cancer incidence went up, not down. All right. So I think this is a powerful kind of visual. And one last thing, not to beat a dead horse, but the myth about breast cancer is real, and women need to hear this, right? So there's 1,000 women in a theater. This is what this image is looking at, okay? And that one black dot, that one seat would be less than one additional case of breast cancer for every 1,000 users per year. It was based on that Women's Health Initiative study was stopped and scared everybody. In fact, this less than one additional case per 1,000 users, when they looked back, it was actually not statistically significant. So I would say this doesn't even apply. And note that the hormone that was being used in this case was a synthetic estrogen and a synthetic progestin. So even this very rare risk, which is actually quite reassuring if you needed to take a synthetic product for whatever reason, it's very safe. And this risk is the same to having an extra glass of wine a day, being obese, or having a sedentary life. So, and the other super interesting thing, I love to point this out to people, the Women's Health Initiative was not all bad. We got some interesting data. We found out that if you were on hormone therapy when you got diagnosed with breast cancer, you didn't have a worse outcome or a higher stage. In fact, you had a better outcome and a lower stage. So I think that's an interesting fact there too. So the big question, you've told me all these symptoms. Well, can I take this, Dr. Menn? Yes, for the vast majority of women, modern menopausal hormone therapy is incredibly effective and safe. There's a few kind of blanket contraindications that are out there. And these are like things that we should talk about. And doesn't mean that you absolutely can't take hormone therapy, but we need to have a nuanced discussion. So that would be acute active liver disease, an unexplained postmenopausal bleeding. And once we work that up and figure out what was the cause, and often there's very benign causes, you can be treated. A history of an unprovoked blood clot, stroke, or serious cardiac disease. And again, I should have an asterisk here too, because in some of these cases, you can absolutely safely have hormone therapy. And then something that is of personal interest to me, because I do have a personal history of breast cancer, there is this idea that a personal history of breast cancer is a contraindication, but really it's a nuanced conversation around the risks versus benefits of taking hormone therapy. And in many cases, women with a history of breast cancer can and do take hormone therapy. And then this is also interesting. So contrary to popular belief, these are all the conditions where hormone therapy is actually extremely safe, very appropriate, in fact, can improve these different conditions.